So good afternoon, everybody. Thank you for completing the survey. Those of you that have, that's the first bit of admin complete. It is a little bit interactive this session, so we will be getting you involved in some discussions, but also with these surveys to complete. My name is Zoe Sharpe. I'm a Senior Development Manager at Dandara Living. Dandara, we're all over the UK developing. We've both got a house builder side of the business and also the city centre brownfield redevelopment on build to rent and also PBSA. I'm based in Bristol. We've got 4 sites in Bristol currently. So welcome to our presentation. This is a combined and collaboration effort between Dandara, Oxford Properties and the Trude research team. So we've got Martha and Becky here today from, they're the brains, they're the academics as part of the research team. So the presentation is around, as it says on the slide, opportunities to prioritise health impact in urban design and development. If I get stuck on some of the research-based questions, then the other 2 will be able to help me, but there are opportunities to ask questions. Happy for those to just be put into the chat box as we go through, but there will be discussion points through the presentation that again can reach out to us during those sessions. Go on to the next slide, please. So the focus today is to look at and discuss issues surrounding health and health equity within urban development. Some of you will know lots about it, while others may be curious just to know a bit more and understand a bit more about the research that's gone on within this project. The aim today is to bring us all together, have a chat, get us working together, possibly meet people that you haven't met before, and just start to think about and look at better ways that we might be able to address health and health equity in our urban spaces, particularly within our industry and the built environment. If you have a look through the slide for the session content, but essentially it's looking at the influence of the urban environment on health, the risks of not prioritising health in what we do, the benefits of prioritising health to us and to society as a whole, looking at some examples of what others are doing on health, and that will be us. Dandara will be one that we're looking at, and then what next. And the Trude team have been pulling together some helpful resourcing for signposting to kind of help us know where to start looking for resources and things on quite a wide and big topic. So the next slide, please. So that this slide has got a graph on and some stats, and I'll just run through some of those, and it gives us the starting point really as to why we're looking at and why this project has been undertaken, looking at health and what's the problem that's been identified. Over the last 40 years, life expectancy has been increasing generally due to advances in healthcare and improvements in living and working conditions. So there's been a reduction in mortality at increasingly older ages. However, you can see those lines on the graph starting to dip. Over the last 13 years, this increase in life expectancy has slowed and started to decrease. The evidence and statistics that we're starting to see is that those living in the most deprived areas have, on average, 19 years fewer healthy life expectancy compared to those living in the least deprived areas. And non-communicable diseases, so things like obesity, cancer, mental health, illness, that's estimated to be contributing to 89% of deaths. The other thing to highlight is that medical care is the largest cost to us as a society, and therefore to government spending, and that we're looking at, well, you've got the numbers on there, almost 10% of annual government spending, so around £200 billion spent on medical care. There is also significant associated costs from lost productivity. For instance, obesity, there's an estimated £27 billion worth of costs due to the effects of that on earnings and also welfare payments. There's a much bigger elephant in the room, which is the climate and ecological impacts, and those are likely towards non-communicable diseases, but these are likely to dwarf the costs that have already been mentioned. But we know that climate and ecological warnings and putting it at the top of the priority is kind of centre and foremost, and it certainly is within the built environment. It's just how we go about tackling it in the most efficient way. All of this matters because government is trying to reduce its costs, as it's probably quite a timely moment with the budget coming next week. And it's already looking at links between health and urban development, which is likely to see policies coming forwards trying to look at reducing the impacts of urban development on health. And we're probably going to see some of that come through with planning policy changes and all these big ticket items that are being talked about since the new government's come in July. Next slide, please. But this slide is all about what, before Dandara and Oxford Properties got on board with the TRUDE team, this is all of the work that the TRUDE team were doing beforehand. And essentially, they have done a lot of interviewing people, collecting information, trying to understand views, I guess, from our industry on healthy environments, health and health equity. I think the biggest point that has been highlighted is that we all agree healthy environments emerge from careful placemaking and keeping. The TRUDE research project has done, as I've said, a great deal of information gathering in phases 1 and 2 and engaged with 224 senior decision makers from across all 3 sectors, so government, business and civil society, to better understand how urban development processes work and where and what interventions are needed to prioritise health. The findings are shown on this slide, and ultimately we all agree that health is important. We all agree that health needs to be moved up the priority list in urban development, and we all agree that many colleagues are doing more to better understand and incorporate health into business and decision making. However, and there's a big red circle on the slide, obstacles were reported that prevented progress in others' practices, resulting in inertia. And the trickiest ones were, and when I say tricky, about how those are overcome, feeling insufficiently powerful to act and affect change. The kind of business as usual that we probably suffer a little bit in the built environment and our industries, and the traditional ways of thinking that prevent change. And then also it's that uncertainty and just being unsure about what we, whether it's individually or as individual businesses or as a wider consortium, what we can do to act on health. Go on to the next slide, please. So what are the conditions for health? This slide is showing a multitude of things, but essentially we've got a diverse range of social, economic and environmental factors influencing mental and physical health. So these wider determinants of health, it's a broader concept than our own personal or family health, although it is important and relevant. We've got everything from where we live, the state of the environment, income and education levels, and then relationships with family and friends. So this health map is showing literally everything, but you've got it at very differing scales. So you've got the global level of climate change and biodiversity, got the individual level of hereditary, age, gender, but also we've got everything in between. So we've got the natural environment, activities, local economy, community, and then of note, the built environment. All impact health experiences and outcomes, and all are interconnected. Next slide, please. There's quite a lot of detail on this slide, but we know how health is being affected by the urban environment because we have things like this. So it's all part of going through a planning process, designing spaces, designing buildings, and this one particularly is looking at neighbourhood design. And that this slide and the next slide will just go into, I suppose, one particular area of how this is demonstrated that health can be affected. Research indicates that the research this team have been doing indicates that the environment in which we live is inextricably linked to our health. For example, the designs of our neighbourhood can influence physical activity levels, travel patterns, social connectivity, and mental and physical health and well-being. So we go on to the next slide, we'll just look at walkability as a subcategory of neighbourhood design. I mean, it's quite obvious, an increase in walkability and improved infrastructure that encourages walking and cycling fundamentally results in physical activity, and that's by everyone, including older adults, mobility among older adults, and also importantly, social engagement. So that principle of bumping into your neighbour and having a chat, that sort of thing is therefore encouraged and enabled. That social engagement and activity leads to an improved mental well-being and also reduces the risk of non-communicable diseases. At the bottom of the slide, there are other tabs. So there are obviously other aspects of the built environment, including housing, healthier food, natural and sustainable environments, and also transport, although arguably some of this around walkability would also feature in the transport section around sustainability and sustainable modes of transport, etc. We go on to the next slide, please. This one's my favourite one because I get to talk about this later for our examples within Dandara. But how is health linked to social value and social impact? I think that this has come much higher up the priority list for our industry, and I think just wider across all business and industry. And probably the trigger has been COVID and had us all thinking about and doing more on health. Developments are being looked at a much broader level in terms of social impact, and it's increasingly being expected and measured. In fact, a couple of weeks ago, we were invited in to see one of the local ward councillors where we're developing in Bristol to ask how we're doing, what we're doing in terms of working with the local community and our social value and impact, I guess, plans. And it is about translating from talking about things into actually doing and implementing. And that was one of the things we spent quite a while with him. He's a new politician, but just really keen to understand how that can trickle through as well with what the local authority might be doing to support and enable too. Social value creation gives us an important tool and reason for incorporating health in what we do. As I've said, it's emerging as a requirement for investors within planning applications. Bristol, again, as an example, we're starting to see a lot of things being front-ended with planning applications for submission. So we fully anticipate that things like a social value impact statement or commitment will be required to submit a planning application, probably not in the not too distant. We've already had that in terms of public art and also employment and skills and what we're committing to at a local level, which also feeds into social value. There's still a bit of or lack of consensus, I guess, on or different ways of looking at what social value means. So there isn't a settled definition, but broadly it can be organized under three themes. And those are up on the screen now. So that's looking at jobs and economic growth, health, well-being, and the environment, and then the strength of community. But ultimately, talking about health specifically, as this is what the presentation is about, health cuts across all three themes. So, for example, if we look at employment, those from underserved communities are more likely to get sick with fewer resources to avoid getting sick or to leverage when they are ill to improve or manage their condition. So it's things like access to money, private healthcare, that kind of thing. So by ensuring local people are in decent employment provides more resource for them as individuals to stay healthier for longer and manage their health conditions more easily. Can we go on to the next slide, please? I don't know if this goes straight into play, but this is going to be, this is a video. So if it plays, I'll let it play and then I can talk afterwards.
So my name is Shaka Hussain. I live with my wife and three boys, 24, 17 and 15-year-old. We live on a main road and it can get really hectic and really busy. When we first moved into this house, it was like a gift from God to us. When we walked in, myself and Shabnam was in tears. However, we didn't anticipate the effects of being on the main road.
I think I need to cut down on the coffee.
Well, how many coffees are you drinking now?
3 to 4.
You didn't used to drink that much?
No.
The traffic noise can get really bad. When you're coming off the M62, it's another road that can be used as a shortcut to other routes into city centre. Because we have a local hospital just 2 minutes down the road, we have a lot of ambulances and police cars going past. It's like a firework going off, and then that's it, wakes you up. Then it's really hard for me to go back to sleep.
Now what's that?
Yes, please. She's got different sound.
Oh no, it's an ambulance. Oh, and
no,
and a police. Oh, it's both.
They're both. We have a direct bus stop outside our front door as well. One of the annoying things is, you get this door that swishes open and swishes shut. And even that noise during the night can really wake you up. I sometimes get up as much as 7, 8 times a night. Then I'm thinking I'm disturbing Shabnam, then I'm moving away from the bedroom. So that's some effect on the relationship as well. And if you're not sleeping 3, 4, 5 nights a week, then it's a big issue. I think maybe we should count the cars one day for 1 hour. Because I wasn't sleeping, I was getting stressed out. I was getting anxious. I was breaking down. Then the GP said, okay, well, we need to help you relax so at least you can have a good night's sleep. That's why I needed to start the tablets. I'm on mirtazapine, so I have been on them for quite a few years.
How many is that?
67.
All right.
In our work situation, we run a food bank charity called Rainbow Surprise. You get that on there? Somehow. I think one of the biggest things is the people that come to our food bank, they're already really vulnerable. Don't forget the pak choy as well. We've got lovely fresh pak choy. Then if I'm already in a bad mood because I've not had good sleep, and if I'm not paying full attention, I might not be as sensitive as I normally am. Just get them in the back then. Right. Proper busy morning. You know, last night, all that noise, traffic on the road, I just didn't sleep at all, and I'm knackered now. Looks like I've done already a whole day's work.
And we've just started.
Yeah, we've just started. So I heard you was coughing in the kitchen before.
I don't know what it is. I think maybe it's because of the increase of the traffic or something. I don't know. But I've been wheezing a lot.
So my kids and my wife, they have their own health issues as well. Her asthma over the years has gone worse and worse. She's on a steroid-based inhaler. She needs to take it twice a day. And then she has the Ventolin, which is only supposed to be used about 3 to 4 times maximum a day. But there's been times where she's used it up to 15 times a day because her asthma is that bad. We're not breathing in good air, so the asthma can get worse. My oldest son Hamza, he's 24. He's always coughing upstairs because his asthma's been triggered.
Yeah, no, my cough is still bad, and how it is now, yeah. It's not getting any better.
2 weeks ago, he was given a course of antibiotics because his chest was bad alongside his inhalers, and he's completed that course. And a couple of days ago, his cough starting again. When Hamza was at university, his cough has almost disappeared. When he's moved back home, the cough started developing again, and it's grown and it's grown. He's done his degree in biomeds. Currently looking for the right job, but he's working part-time in the local supermarket. If you can't sleep because you've got this traffic noise, he can't concentrate on making up a decent CV for himself and applying for jobs and preparing for an interview. Again, that's affecting his life. That's how strongly I feel, because it's not just affecting our health right now, it's affecting my boy's future.
So I've seen that Martha's just put in the chat, there are some other videos that can be viewed on the Trude website, but that's just one of 3 that have been prepared by the Trude team. And I think it's just worth summarising with that we don't all face these challenges equally. And whilst it's not the responsibility of any one organisation or industry, we all have a role in contributing to these issues arising, as well as finding solutions. Each role is different. For instance, looking at those really early stages of site selection and location for where we might be developing or creating new places to live, work and play. Designing buffers to major infrastructure, because whilst it's really positive having bus stops and buses and sustainable transport systems, if that's causing impact because of its proximity to a front door or windows, then those things need to be looked at. Insulation, acoustics, ventilation comes into things like investment criteria, build costs, design costs, all of these things, how we design better. And then there's the ongoing issues relating to place keeping. So, and part of this is around who continues to own that responsibility from land acquisition through to development, through to then operation of assets and places into the future. So yes, that's kind of the summary there, and it's a problem that we all share, but it's a problem that we can all solve together. I think some of the mechanisms are there around planning policy and looking at these things at an early design stage, but some of those ownership issues through the life of a project can be a challenge. It's worth just pointing out that Dandara, we're on board really from day one to day residents moving in with our build to rent product. So there are some of these things that we're trying to look at focusing a bit more on, given that we've got that cradle to cradle approach, because we're also the builder on our sites. And prioritizing health in what we do may feel risky. There's as I was saying, this perception of an unknown financial cost, how it's going to impact investment. The outcomes are unclear. It's enough evidence to effectively measure outcomes. So like these improvements in design or all of these things, how do we track that happening? And again, the different ownerships through the life of a project can be tricky in sort of keeping track of the outcomes of those interventions. But as I said, the risks associated with not doing enough and not prioritizing health, they're increasing. Expectations are changing. As saying before, government in respect to the planning process, where applications risk not being registered unless health is explicitly addressed. Society, it's not acceptable for a lot of us, whether we're in the built environment or not, and whether we're professionals or it's just at a personal level, you know, how we work, live and play is becoming much more of a focal point. And also businesses and also investors and the priorities and key elements of the choice of how we invest. The change will continue, and expectation to incorporate health meaningfully will increase. And we've got the central government departments, DLUC, investigating and seeking to create clearer and stronger policy frameworks around health in urban development. We've got climate change and sustainability issues, putting pressure on traditional ways of creating urban spaces more and more. And we have got this recognition of additional costs being associated with poor health due to poor sustainability practices, so overheating, for instance. Another interesting link is being made by coroners to poor development practice, specifically homes and health impact. And they are, it's been shown, willing to draw a causative link to, for instance, air quality, mold, or poorly undertaken refurbs. So essentially, the public sector and the private sector are being forced to answer questions in inquests and inquiries about actions and decisions that have been made in terms of design and delivery of buildings, as well as these more sort of public open spaces as well. Go on to the next slide, please. But there are benefits to integrating health to us as an industry, and they're ones that we all recognise. And the most exciting, and it goes back to what I was trying to say in our summary, is that all of us, whichever discipline we're in and whichever part of it we are, we could be viewed as market leaders in prioritising health and health equity in our industry. And it gives us an opportunity to help shape policy and best practice. And it's viewed positively by all stakeholders, so employees, the local community, investors, and by government, central and local level. We'll go on to the next slide, please. And there are benefits to integrating health into society. We're just up on this, it looks like there's a lot of information on this slide. There is, but we've got a plan up on here, a map of Froome Gateway, which is a regeneration area in Bristol. On the other side, we have a bit of a table with lots of green, but also some red. So essentially, the True team, part of the research of the research project, has also been looking at what's called the house model. And it's trying to look at essentially calculating the benefits of creating extra open space, amongst other things. So essentially 6 million people in the UK do not have access to a park or green space within a 10-minute walk of where they live. But green space unlocks a wide range of health benefits, reduces risk of depression, diabetes, and obesity. So those are the non-communicable diseases that I was talking about earlier. As I said, this is Froome Gateway up on the site. We've actually got a scheme in for planning within this framework area, and the True team has worked with Bristol City Council as part of putting in place a planning framework. There is also a very detailed health impact assessment for the whole area. So we have obviously responded to that within our planning application, but it's worth just having a look at just the wider regen area. So Riverside Park is 2.4 hectares. And on the slide in the table, it's just showing 4 scenarios within the house model of essentially health savings related to this green space. So you've got the baseline, the existing green space already has a number of health benefits unlocked. So you've got activity at 2,632 across all scenarios. it is across all scenarios, so scenario 1, 2, and 3 as well, but also an increase in asthma at 5. So that's hay fever. So that's where you've got some things in red, so the negatives. But if you look in scenario 2, adding an additional hectare as a block increases health benefits. And the examples that you've got there, you've got a reduction in diabetes, so 10 instances of that, and obesity, you've got 41 instances. The reduction in diabetes alone has a £22.7 million health saving over a 25-year period. I've been told it's not necessary to explain the house model on this presentation, but if you have any more questions on that, then we can take those away, and there's another team that's dealing with that. And I think probably there can be a separate session on it if it's of interest. But absolutely, feel free to ask questions, but we can't answer them. We'll pass them on. If we go on to the next slide, please. So this is just, I'm just gonna talk a little bit around our journey, the Dandara Living journey, and what we're doing on health. I think this is also to give a little bit of an insight into probably like the length of time it takes to get buy-in and for it to become you know, an absolute, every single part of the business is on board with it and moving forwards in the same way, I guess. So the Dandara Group is a mixed-use developer, contractor, and operator. I've mentioned that before. It's primarily homes for sale. So we've got the house builder side and also for rent, Dandara Living side. Dandara Living focuses on brownfield city centre urban redevelopment, and that's who I work for. And it's quite a new business line within the Dandara Group, given how old the business is, from the sort of late 80s. So our journey in terms of sustainability, and this is our ESG roadmap up on the screen. We've got a few of them items dulled out, and we've got the other ones to talk about in a bit more detail in sharper focus. But our journey started properly in 2021 when we appointed external consultants to carry out a materiality assessment. In 22, that report came through with next steps, and our head of ESG also joined the business at group level, so across the house builder and Dandara Living bits of the business. The board signed off on our strategy in 2023, and this generated the ESG roadmap that you can see in front of you. From 2024 onwards, well, 2023, but into 24, there was some pilots we had to run to help the board come to understand and come to a decision about all of the KPIs and measures that were being presented to them. But we're in implementation mode now. And some of the examples, as I've said, are shown in not dulled out, so still in the spotlight. And there we've got relating to healthy and sustainable communities, building well-being and productivity, purposeful construction and placemaking, and biodiversity and green infrastructure. And this is all around one of our pillars in our sustainability strategy is to create thriving communities. So the one, if we go on to the next slide, the ones in red on here, so stakeholder engagement and partnership. But essentially, one of the things that has come out of this, essentially trying things out, few pilots, that sort of thing, is we've absolutely have had to focus on and target our stakeholder engagement and partnerships element of our roadmap. And this has involved creating a social and local value framework for the whole business, and also piloting a plan on one of our sites in Bristol. So that was our site in Bedminster. And as I said, this has helped to get, as I've got on the screen here, the company support from at board level, but also across every single one of our business units. And that's from HR, recruitment, the QSs, so cost, commercial, construction, planning, development, appraisals, you name it, everybody is on board with that. Procurement, they're also very important. So it's been a real big effort over the last 2 years to kind of get that coming through every part of the business, and there's still work to do. It's still a continual message and implementation process, and then again, all employees. So we've had that commitment. We've also had put into all our processes that I have a budget in all appraisals in terms of our social and local value deliverables. We have a finance process agreed. We have things being added to people's job descriptions. So it's really trying to put this at heart and center of everything we're doing. Sustainable procurement policy, and looking at getting clauses into consultant and subcontractor appointments to support and contribute. So the architects, the QSs, the landscape architects, the building surveyors, you all join with us on this journey and look at how we can do this together. Essentially, what I'm saying on this slide is, without having put these plans in place, I think we would have found it really difficult to know what a community needs in order to be healthy and sustainable. We're relying on that feedback from local and neighbouring residents and businesses. Whether the building wellbeing and productivity has been designed effectively, as I said, that's another step that we've got to go through with feedback from our residents, which we have a lot of, but not on the schemes that we've been doing these live plans, social and local value plans. Whether we have purposefully constructed and placemate, and whether we have created biodiversity and green infrastructure. And that's what we're starting to try and measure coming through. But these plans have been a platform for more open and transparent discussion on the local needs in the areas within which we develop. So again, on the social and local value bit, you've got some stats on there about our local, we've got 3, so it goes back to the slide we were talking about in terms of social value. We're looking at local employment and skills, local procurement, and also supporting local community groups, charities, events, and small businesses. And that just gives some high-level stats on what we've achieved to date, and that's across the whole business, not just in Bristol. We have a social and local value plan in place for all of our projects now. It's also worth mentioning that we do have other targets that we want to hit in terms of home quality mark, BREEAM, all of those things that actually industry has a process and a way of doing things in place. It's just about adopting them and getting on with it. And apparently we got a shout out at the Local Government Association conference from the TCPA and BREEAM for our adoption of home quality mark across our certainly on the Dandara Living side, and I believe it's also on our house builder side as well. So if I go on to the next slide, just going to talk a little bit about Grosvenor. So who do I think are also doing some interesting things on health? So they're in London. This links back to our journey on creating and delivering and measuring social and local value, and turning the tide on business as usual. So I actually met the lady who has been behind Grosvenor and all of these things you can see up on the screen. I actually did an EG Future Leaders program with her in 2020, and I've kept an eye on what she's been up to. She is now the head of community engagement and insights at Grosvenor, and the program we were on was training us to public speak, actually, and hers was on voice, opportunity, power, which is up on here, and that was how we engaged the younger generation in the planning process. But just watching what they've been doing and wanting to do better from our point of view, it's been really good to keep an eye on how they're progressing things and how they are looking at doing better with engagement and these community charters and looking at addressing short-termism. Grosvenor is a long-term holder, investor, asset manager, looks after their residents and their business tenants and things like that. But it's how have they gone about informing these activities, the data they've collected, and also the stakeholder engagement to get to this level of support, I guess, with what they're doing across their whole portfolio. But again, I think the key here is that long-term ownership and commitment to an area where they are, and and being there from day one into the future, essentially, with no sort of end date. There is that underlying desire to want to keep doing better for the areas within which they invest and own. But thank you, everybody, for engaging. I think, can I say that they're our best audience yet? Oh yeah, I'm getting a nod from the Truth team. Excellent.